Good morning, and thank you very much for joining us. I am Yori Folari. Okay, today we'll focus on health, as it were. And we have a special guest for that. Well, special guest in terms of she's also a special advisor to the president on health. Our guest this morning is Dr. Salma Anas. Dr. Salma Anas is a consummate professional. She's been at it and has cognate professional experience of over 25 years. At one time, she was the Commissioner for Health in Borno. This goes back to 2015. She's also held down very senior positions in the Federal Ministry of Health. Good morning to you, Dr. Salma Anas.
Thank you. Good morning.
Yes. Okay. Well, you know, first of all, we're glad to have you on our program to talk a bit about the presidents, because I imagine there's so very much to say. So we'll see how much of that we can fit into our hour-long program. But there are quite a number of you. So maybe the thing to do is for us to get to know you a bit better. So who is Dr. Salma Anas, who is Special Advisor to the President on Health? Go back a bit.
Okay. Thank you, Folari. I'm a medical doctor and a public health specialist, a fellow of the National Postgraduate Medical College, and the West African fellow, member of the West African College of Physicians. So as a public health physician, I have worked in the space of health sector development, specifically in the area of health system strengthening from primary health care, secondary up to tertiary level of care. I was opportune to work at all the levels of care in Nigeria, the tiers of governance, at the primary health care as part of my residency training in Zaria, and also at the federal government, at the Federal Ministry of Health, and also at the state level, subnational level. I worked in Borno State as the Commissioner of Health under the leadership of Governor Kashim Shettima when he was the governor, now the Vice President of the Federal Republic of Nigeria. I was also opportune to work, do some development work with the international organizations, specifically with the World Health Organization in the Middle East, that is within the Eastern Mediterranean region, as a country HIV/AIDS officer and also as an advisor at the WHO EMRO office. And I also worked with the UNFPA in country as assistant country rep and focal person in charge of reproductive health and HIV/AIDS. So during all the period of my work, I was able to work also as a civil society person under NGOs funded by different partners, mainly UK Aid, which is currently now called FCDO in Nigeria. They've changed the name, and also USAID funded project. Some are also Japanese funded project or Global Affairs, a Canadian government funded project. So I've implemented a wide range of projects in Nigeria, including highest burden states where we have maternal death and poor child survival in 6 states of northern Nigeria. I've also implemented projects funded by UNHCR in the refugee camp in Cross River State and also in Benue State in Nigeria. So in a nutshell, this is just a summary of the work that I have done across the country at national and the international level, but all within the health sector, though I have also had little experience of work in the education sector, in the humanitarian crisis.
Oh, okay. Yeah. Well, that certainly does help putting you in perspective. So where did you have time for politics in all of this? I mean, here you are, special advisor to the president. So how did that come about?
So it's really interesting because as a result of the work I did in one of the projects I implemented, which is one of the largest flagship projects in Africa, improving maternal and child health in 6 states of northern Nigeria, funded by the UK government, I came very closely with policymakers and then I realized that without bridging the gaps between us, technocrats, and politicians, we are not going to achieve success. Because the politicians need to understand why we need to improve health, why we need to have adequate budgetary allocation, and in a sustained manner for us to realize that. So the work I did in Kano, in Yobe State, in Zamfara, in Jigawa State, you know, it shows that as a politician, when you convince them, they do a lot of role, they play a lot of influence, they influence the governors to dedicate resources. And these are states where we've been able to establish the state contributory health scheme the drug revolving fund scheme, which is still sustained and they are ongoing. In fact, in one of the states, working with other partners and politicians, we're able to set up the first Kano State Trust Fund, that supports vulnerable people. So, and the experience of working also as Commissioner of Health in my state brought me very close to politicians. And we realized we're able to do quite a lot of things and get things done, despite the humanitarian crisis as of that time, because that was the peak of the crisis. And so a lot. When I came back to the ministry, I was able to push and ensure that we also have a health sector response to the humanitarian crisis that led to even the Northeast Development Commission and the Ministry of Humanitarian Crisis. So I thought, why don't I try politics? And you can't believe it, Folari, I contested for the position of the senator in my constituency, Southern Borno, in 2019. And it was a lot of learning, a lot of success for me, and a huge curve that I have learned so much that as a politician, we can make a lot of impact. So that was the beginning of it. So we are now talking about this administration. When this administration pre-election came, President Bola Ahmed Tinubu indicated interest. And we said, we together came together with some concerned citizens. And I must mention Dr. Jide Idris, whom we felt that we must do something differently. We must be able to set an agenda that will be sustained in this country. So we tried to start working on the agenda, meeting with stakeholders to identify what are the problems. And this was also presented to the president, who also have his own agenda of what he wants to achieve. So based on his agenda, we worked on it and did a lot of pre-election stakeholder engagement. I was anchoring the northern Nigeria. And the health industry is so large. All the categories of health workers were covered. They're so large. All diverse, up to the level of the hospital attendants. So we mobilized coordinators and then came together and did a lot of engagements with them and came up with an agenda based on what the president wants to achieve. What are the challenges? How do we overcome? What are the strengths that exist that we wanted to continue? This was presented to him, and he was very happy around about it, and because it aligned fully with his aspirations and campaign promises. So after the election, we were able to come together again under the president, the Presidential Advisory Committee on to the president. Health sector is part of it. And the president is very concerned about the health sector because he is someone that believes that without adequate health, you cannot achieve meaningful development. So I was appointed to chair the Presidential Advisory Committee subcommittee on health, which we developed the policy document around his 8 campaign promises. And I may just quickly mention those campaign promises because those should be the areas that President wants to ensure that he delivers to Nigerians by 2027. And I strongly believe that he's still on track and committed to those commitments. So first, it's around issues of governance, right from who do we appoint to lead the health sector, and then how do we address social determinants of health. So all those have to be brought together under one effective coordination system in the health sector to avoid fragmentation, duplication, and silos, implementation of activities in the country who does not yield to meaningful effect in terms of impact. So those were areas around leadership, coordination, and even reviewing the institutional arrangement in the health sector. That was of concern to President Bola Ahmed Tinubu. And then he looked at also the area of financing because he is committed and he has realized the huge funding gaps in funding. Of course, we realize that government cannot do the funding alone, but we need to mobilize and ensure that we harmonize all resources together so that we have maximum effect of funding. And government must demonstrate highest level of commitment to increase funding for the health sector, not only at the national but also at subnational level. Human resources was a huge issue, which has always been there for years in Nigeria, but it became worse, with the advent of the COVID pandemic. And that was an area President also indicated area of interest. How do we increase production of human resources for health across board and also retain them and create enabling environment for our health workers to ensure that they provide quality healthcare services to all Nigerians, irrespective of where they come from or whatever their social affiliations and cultural backgrounds are. The third is that was so dear to Mr. President was about local manufacture. President Bola Ahmed Tinubu is very concerned that we must produce our medicines, we must produce our drugs, we must produce our our medical equipments, including commodities. They are all doable in Nigeria. So he's concerned about how do we transfer technology to Nigeria? How do we explore and create enabling environment for potential manufacturers so that they can produce in Nigeria to reduce the cost of our commodities, medical commodities and drugs in Nigeria, and possibly also to export to other countries. So those are areas, and he has matched those areas. And then the other area that he has also is about the pandemic, the public health security, which we put them under public health security, building a strong resilience systems that will prevent that. Then we also looked at area of his concern, its delivery of quality health care to populations of Nigeria, with focus on the vulnerable people. And when I talk about vulnerable people, we're talking also about women, children, the elderly people, including people with disabilities. Those are areas of concern for President Bola Ahmed Tinubu, and he made promises around those areas, which has to do with integrated healthcare delivery services across, from the primary healthcare level, secondary level at the state, and also tertiary institutions that are manned by the federal government of Nigeria. So a lot was done, but I must also add the last two, which are specifically around areas of information management, data generation, because whatever we do in terms of policy formulations and practices, they must be guided by evidence. They must be evidence-based, based on data we have generated. What has worked, what has not worked? How can we improve in what we are doing? So data management, digitalization, and use of modern technology is a key component of this administration, so that we should be guided based on evidence of what we do, and also research is a part of it. So lastly, I must mention, it's about partnership. Partnership, as I mentioned earlier, government cannot do it alone. We must form a formidable partnership around the health sector and maximize the effect of all resources and align in line with the vision and priorities of President Bola Ahmed Tinubu. So those are the 8 priority areas of Mr. President. And those are areas that he canvassed and we campaigned for pre-elections. And after election, there were the areas that were fully articulated. And President remained committed on those areas, and he's delivering. We are just 14 months old in the administration. But I can tell you, Folari, I can pick each one of them, and I can tell you President has made progress within the 14 months, because we have a tracker. We have the first 100 days in office, which was 100% accomplished. We have 12 to 18 months, and we are 14 months today. And then we have after 18 months to the 4 years by 2027. So in each of these aspects, programs have made progress in the aspect at his own level and at the level of implementation. That is by the Federal Ministry of Health and its parastatals, led by the coordinating Minister of Health, and also at subnational level.
Because where you've just landed is